We've been telling you about the physician shortage across most rural communities in Kansas and how a state university is trying to help.
But some medical experts say it's not enough. Lauren Seabrook continues her in-depth look at the doctor dilemma.
Well, medical experts have done extensive research on the doctor shortage and believe the problem won't get any better in the next 50 years. So some hospital leaders are looking for new ways to treat patients in the smallest communities of Kansas. A desperate need for doctors in rural parts of Kansas has some hospital leaders replacing medical professionals with machinery.
It's a huge shortage. It's been around for years, and the federal government projects in Kansas out 50 years, and those projections show that the shortages won't go away in the next 50 years.
Hamilton County Hospital in Syracuse went nearly 8 years without a doctor, forcing the people who live there to travel miles for health care.
It was a challenge. If you had a sudden illness, an infection, or severe cold, anything like that.
But hospital CEO Brian Coffey found a way around the chronic physician shortage.
I have complete control of the cameras.
Telemedicine in the form of a robot.
This is a complex piece of equipment that actually has a 12-fold magnification, so the doctor can look at lesions on the skin better than with his own eyes.
It's a big relief. It's a big relief, and I feel like it's going to be a great advantage to this hospital and to this area.
The only thing I can't do right now is palpate or touch you or shake your hand.
Coffey says the robot gives his hospital the opportunity to see patients dealing with countless different conditions. Anyone working at the hospital can maneuver the robot, and the attached camera gets an up-close view of the patient.
This is going to shatter the box around that old paradigm, because this is going to allow the physician to be sitting in Starbucks, get a call, open up his tablet, log in, and see a patient in the ER.
Which Coffey says will be especially vital when people suffering from a stroke come to his hospital.
In a neurological situation, time is of the essence, so this will save a lot of brain damage.
In the past, those patients would be stabilized and shipped by ambulance or medical helicopter to a hospital with more resources. The robot keeps them in Syracuse.
It will allow patients to come here, 10 minutes, 20-minute drive here, and be seen immediately by a neurologist. It's unheard of in rural America.
The telemedicine is going to be fantastic when they get that online. It's really going to help. And it won't just help the citizens of Hamilton County, it will help citizens in western Kansas.
Coffey believes telemedicine will not only save lives, but save hundreds of communities around the state desperate for medical care like his hospital once was.
That little hospital that the doors were going to close, through telemedicine and some providers coming on board, have set the standard of care that can be a model for all of America and all of the rural hospitals, not just Kansas hospitals.
Coffey says the robot is a bargain. He says one patient a month that can be treated at Hamilton County Hospital, instead of being shipped out, will pay for the telemedicine. If a doctor finds that a patient needs further medical attention, they will still be taken to a facility with more resources. But Coffey says that may only be half the time, and the robot saves many people the trip by diagnosing the problem in Hamilton County.
Coffey says telemedicine is being used for military members overseas. He says a soldier in Afghanistan, for instance, can see a doctor through the robot in the United States. If you missed any of our 3-part Doctor's Dilemma series, you can see them all again at kwch.com.